Hello students, now we'll do the anatomy of thoracolumbar fascia. Thoracolumbar fascia is important topic and as well as it is little bit complex topic, so we'll try to make it as easy as we can. First of all, the definition: what is thoracolumbar fascia? It is an extensive facial complex attached to the medially to the vertebral column. The thoracolumbar fascia is composed of complex arrangement of multiple facial layers that is most prominent in the caudal area. नाम बता रहा है बच्चों thoracolumbar fascia. Thoraco thorax and lumbar. So thoracolumbar fascia is the facial complex. Here you can see this facial complex white color में दिखाई दे रहा है आपको, which is present in thorax as well as in lumbar. So दो जरा होगा बच्चों, thorax में भी है और lumbar में भी ये fascia present है. And it is present on posterior aspect. So dorsum of the body posterior side पे होता है बच्चों. You can see here in this diagram, this is anterior side of the body, this is posterior side. So posteriorly we have dissected the skin, then we have dissected the part of latissimus dorsi. We can appreciate the thoracolumbar fascia. This fascia covers the muscles, deep muscles of back, mainly the paraspinal muscles. Paraspinal नाम से indicate कर रहा है बच्चों, spine के around, these are the spine के laterally, these are paraspinal muscles. So thoracolumbar fascia is the facial extension which is present in thorax and lumbar region, and it covers the paraspinal muscles. So in this diagram you can appreciate this structure. ये आपको white color में structure दिखाई दे रहा है, and this line, this is the spinous process of vertebrae, posterior aspect of the body है बच्चों, and this white covering is the thoracolumbar fascia in thorax and here in the lumbar region. So इसके बारे में अभी हम थोड़ा सा डेप्थ में बात करेंगे. आई थिंक आपको इसका टोपोग्राफी क्लियर हो गई होगी कि ये कहाँ पे है. सो दिस इज द पोस्टीरियर एस्पेक्ट. हियर अगेन दिस इज द पोस्टीरियर एस्पेक्ट ऑफ अवर skeleton, human skeleton. Here this thing is the spinous processes of different vertebrae. Here we have cervical, thoracic, lumbar vertebra, then sacral. So medial, laterally we have the ribs. Here this thing, now we will do the attachment of this thoracolumbar fascia. It is thin in thorax but it is thick and strong in lumbar region. thoracolumbar, बस बच्चों इस वर्ड को याद रखो, it is quite easy then. In thoracic region, first of all in thoracic region, medially बच्चों we have the this thing, हम बार बार बात कर रहे हैं, this is spine of the vertebrae. So medially the attachment of thoracolumbar fascia is this spine, चाहे मैं thorax part की बात करूं चाहे मैं lumbar की. So thoracolumbar fascia in thoracic region, it is medially attached to the spines of the vertebrae. Laterally these are ribs, and we know ribs are present only in thoracic region, lumbar में तो होंगे नहीं. So laterally in thoracic region, this thoracolumbar fascia is attached to the insert to the angle of the rib. So बच्चों this thing is the angle of rib. rib के parts होते हैं, वो अलग वीडियो है, you can see in that video. So this area, this is the ribs angle. So thoracolumbar fascia medially attached to the spine of the vertebrae and laterally attached to the angle of the ribs in thoracic region. In lumbar region, this thoracolumbar fascia is composed of 3 layers. इसकी बच्चों lumbar region में 3 layers होती हैं. Posterior से चलूँगा, then first is posterior layer, second one middle layer, third is the anterior layer. So these are 3 layers in lumbar region. thoracic region में जो single layer थी जो हमने डिस्कस की, lumbar में अगर मैं posterior aspect से चलूँ, we have the 3 layers. They will enclose the muscles. ये जो cut section है, this is your transverse section at any lumbar area. You can appreciate this structure. This is the vertebra. कोई भी बच्चों lumbar vertebra imagine कर सकते हैं, L1, L2, L3, 4. So this is vertebra. This area is posterior side and this is the anterior side. So diagram पहले clear होगी बच्चों हमें, then easy है. Posteriorly we can see these are 1, 2, 3. These are para spinal muscles. This one is the rector spinae. Then posterior most is the latissimus dorsi. Anterior to it we have the quadratus lumborum. So बच्चों अभी हमने बात की, this thing is the vertebra column. On the lateral side, little bit lateral to the vertebra, we have this thing. This is known as a crus of diaphragm, right and left crus of diaphragm. Then we have psoas major. Okay. Anteriorly, this thing is kidney. So posteriorly आएंगे तो we have these muscles. Laterally, we have muscles of abdomen. Outer is external oblique, then internal oblique, then transverse abdominis. So I think अब आपको ये structures clear है. So first of all the posterior most layer. अगर बच्चों में posteriorly dissect करूं तो posterior most layer हमने अभी बात की. अगर मैं इस एरिया की बात करूंगा, this is the thoracic area. Thoracic area में like this we have the behind scapula, like here we have the thoracolumbar fascia, medially attached and laterally. Below this we have now lumbar part. The lumbar part first of all dissect करूंगा posterior most से, तो we have the posterior layer. This posterior layer is present behind erector spinae muscle. We have erector spinae muscle, उसके पीछे होती है. And superior attachment of this thoracolumbar fascia in lumbar area is the 12th rib. This is 12th rib and this one is the our ilium bone. So thoracolumbar fascia is extending between the 12th rib and iliac crust here like this. Medially हमने पहले ही बात की, it is attached to the spines of the vertebra. Laterally it will attach to the, बच्चों यहाँ bony attachment तो है ही नहीं. You can appreciate laterally we don't have any bony attachment. Bone तो है ही नहीं इसको attach होने के लिए. So it will insert in the muscles or in the fascia of the muscles of the abdomen. So abdomen के muscle होते हैं, we know, external oblique, internal oblique and transversus abdominis. So deep one is internal oblique and transversus abdominis. So this will attach to the transversus abdominis and internal oblique. So quite easy. This thing is the thoracolumbar fascia, blue color वाला. इसकी here we have the upper attachment, medial attachment, lower attachment and lateral attachment. So first of all the posterior layer we can see in this diagram also. Here we have the erector spinae muscle. अगर बच्चों में posteriorly dissect करूँगा, I have removed the skin. After skin we can see this thing. This was latissimus dorsi. So ये latissimus dorsi की अपनी covering है बच्चों, fascia. This is erector spinae. Erector spinae के posterior, this is the posterior side. Posteriorly जो layer होती है, this is thoracolumbar fascia, deep layer or the posterior layer of thoracolumbar fascia. So posterior layer is present posterior to erector spinae or anterior to latissimus dorsi. Clear? Now the middle layer. The middle layer is the second layer. Now green color से देखना बच्चों. Middle layer is this layer. अब हम इसकी बात करने लगे. So middle layer is attached medially to the tip of the transverse processes. So this is the vertebra. ये इसकी tip है बच्चों. Tip of the transverse process को attached है medial layer. Then it will extend laterally. It will extend laterally behind the quadratus lumborum. So this muscle This muscle is quadratus lumborum. Medial layer is attached to the transfer process and behind the quadratus lumborum. Laterally, it is attached to this. You can appreciate these two structures. The fascia of external oblique and the transversus abdominis. Inferiorly, वही वाली पहले हमने बात कर ली. It is attached to the iliac crust. Superiorly, 12th rib हमने बात कर ली थी. Then the anterior layer. In this diagram, we will do little bit revision too, ताकि आपको easy होता रहे. So this one was the medial layer. अभी हमने की जो टिप से अटैच थी. इससे पीछे posterior or the deep layer is also known as the lamina. This one erector spine है, this one quadratus lumborum. Now the anterior layer, again posterior से anterior आ रहा हूँ. Anterior layer will cover the quadratus lumborum. This muscle is the quadratus lumborum, and medially it is attached to the body or to the transverse process behind the psoas major. This muscle is psoas major. Psoas major की attachment here, the psoas major attachment here, where this is the transfer process. So behind the psoas major we have anterior layer. So this thing is the anterior layer. Laterally, again it is present, or it will insert or fuse with the aponeurosis of transverse abdominis or the internal oblique. Inferiorly, ये बच्चा थोड़ी सी ज़्यादा medially होगी as compared to posterior and medial layer. It will attach to the iliolumbar ligament and the crust. Crust सब में common है. Superiorly same है. It is attached to the 12th rib and it is attached to the transfer process of first lumbar vertebra, forming a lateral arcuate ligament of diaphragm. So this is important. Lateral arcuate ligament of diaphragm, diaphragm में आपको पढ़ाते हैं, is actually the anterior layer. Okay, anterior layer से बनता है lateral arcuate ligament. So again revision here बच्चों. This is in thoracic part. Thoracolumbar fascia medially attached to the spine, laterally to the angles of the ribs. In lumbar region, medially is attached to the spines, laterally it is attached to the fascias of internal oblique and the transversus abdominis muscle. Inferiorly it is attached to the iliac crust. Now if I take a transverse section at thoracic level, देखो transverse section लिया बच्चों. This is anterior side, this is posterior. Here we have the posterior side. Anterior side we have taken the transverse section. Again this one is the first muscle, erector spinae. This thing is the vertebra. Then we have second muscle, quadratus lumborum, psoas major. So posterior layer, and when we have the middle layer, anterior layer. So in this way I think आपको clear होगा what is thoracolumbar fascia. अगर अभी भी clear नहीं है then you can ask me questions. Here we have the, I should change the color. This one is the posterior layer. Then we have the middle layer of thoracolumbar fascia and anterior layer of thoracolumbar fascia. So from this diagram, one thing you can easily appreciate, this is the area of kidney and this is psoas major. Thoracolumbar fascia anterior layer, this one is the anterior layer, black color में. Anterior layer is in relation of the fascia of kidney and fascia of psoas major. Relation में है, but बच्चों इन सब का अपना fascia अलग है. Applied note में. So thoracolumbar fascia, अगर मैं बात करूँ यहाँ से था बच्चों, like this इसके deep है, this is superficial we know, this is trapezius, this is latissimus dorsi. Okay, so इनके deep जो fascia है, that is thoracolumbar fascia. Here is we know gluteus maximus. So the thoracolumbar fascia is an attachment between trapezius, latissimus dorsi and gluteus maximus as well as the hamstrings. Thoracolumbar fascia ऐसे attachment है बच्चों इन सब muscles में, then it will act as the supporting role. इसका रोल है सपोर्ट, हमारी बॉडी को सपोर्ट कर रहा है, and helping in the weight lifting of the anything. Then it is helpful in maintaining posture, load transfer from upper to lower trunk, upper part of the trunk to the lower trunk, and it will also take part in the respiration. So thoracolumbar fascia, from this slide you can see it is very important. Okay. Thank you. If you have any question, any query, you can ask me.